Welcome to our session on authorized electronic monitoring in long-term care facilities. This is one of our sessions in the VOYCE virtual conference. So we're really excited to have you here. If you have not yet voted in the poll, go ahead and do that so that we know that you are here for your CEUs. My name is Marjorie Moore. I'm the Executive Director of VOYCE. And with me today, I have Nicole Lynch, who is our Grants and Advocacy Coordinator, and Representative Jim Murphy, who was very involved, really pushed this thing through to get in our State House. So we're really excited to have both of them here with us today. I'm going to go through a little bit of a housekeeping first. So bear with me on that as I set up the screen share. First, our results from our polling. So obviously our favorite St. Louis treasure that everybody voted on today were the St. Louis Cardinals. Looks like the Zoo came up pretty close. I think those Blues that are battling to stay in the playoffs, though, are going to be a little bit sad if they hear about these results, folks. So, you know, got to love all our hometown teams. So next, I want to thank all of our sponsors for this conference, which include Everspring Pharmacy, Quinn Estate and Elder Law, Infinium Pharmacy, Guardian Pharmacy, Health Direct Pharmacy Services, Eamon Gatner Capriano, Attorneys at Law, Your Estate Matters LLC, and Assisted Living Locators. And Lisa Sesti, who is one of our sponsors, is also one of our co-chairs along with Jen Ryan. So I have to thank both Lisa and Jen for all of their hard work in getting this conference together, getting the word out to all of you, as well as all of our committee members who helped out so much. And I'd also like to thank somebody who is not here today, Megan Bailey, who is our Events and Education Coordinator. She's usually here with us, but she's actually getting a much needed and much well-deserved vacation today. So you won't be hearing from Megan, that's why you're hearing from me. So if you did not get a chance to opt into our sponsor drawing, which is something you would have done when you registered, if you didn't check that, yes, share my information with sponsors, you can email your name now, between now and the end of the session, to events@voicestl.org to enter for that. Now your information will be shared, but you are going to get a chance to win a $50 gift card from Guardian Pharmacy. So that's really awesome. So you'll probably want to get in on that. I believe it's an Amex gift card, so you can spend it anywhere you want to, which those are my favorite kind of gift cards. I want to thank especially the Missouri Healthcare Association, who is helping us with facilitating our nursing home administrator CEUs, and then also to the folks who are also helping us with the social worker CEUs. So both administrators and social workers are eligible for CEUs today. Then we have a whole bunch of upcoming webinars for this conference that are still out there. So if you have a full registration, you already have access to all of these. And if you decided to buy one by one, you can still buy into all of these. So on September 1st, we have Ethics of Shared Decision Making in a Time of COVID, when worst case scenarios are all too real. That's going to be a fantastic session. I'm really looking forward to that. September 15th is Legal Rights for Residents in End of Life Planning with Paul Gatner from Eamon Gatner and Capriano. On September 29th, we have Debbie Poole from QIPMO, who is going to be talking about disaster preparedness and long-term care organizations. And then we have a couple coming up even in December. So in October. We're not to December yet. But a lot of exciting ones coming up. So be sure to register for those if you have not yet. And then finally, if most of the people in the audience today I know are long-term care professionals, but if you have family members who have family members in your facilities or residents in your facilities that have questions about this topic, we're going to be doing a community crash course specifically on cameras for nursing home residents. And those sessions are going to be coming up, and they are going to be virtual on September 8th and September 14th. So please feel free to spread the word. You can find information about that at our website, which is voicestl.org /events/family-education. And now I'd like to introduce our two panelists who I'm so excited to have with us. The first is Representative Jim Murphy. He is from the Missouri State House of Representatives, District 94, and he is one of the people that really helped make not only this bill but this day happen. So we're so happy to have him. And then we also have Nicole Lynch, who is our policy and grants coordinator. I call her all kinds of different things. I tell you, advocacy. I throw in words. I switch them up. I'm a terrible boss, but I am really excited that both of them are here today. So thank you to Representative Murphy and Nicole. And then one more reminder, we have our prize drawing, which I think I may have put the slide at the wrong place. Our prize drawing will be coming up at the end of the session. And it'll be for the $50 Amex gift card. I did have somebody ask a question just a minute ago about what time the upcoming webinars are. All of our webinars going forward will be at noon Central. And there we go. Without further ado, I'm going to go ahead and introduce Nicole, and she's going to share a little bit of background for us on this topic.
Thank you, Marjorie. Like she said, I'm the Grants and Public Policy Coordinator. That is my actual title, and everyone gets that wrong for some reason. I'm really not sure why. But I'm just going to go over very briefly with you guys some of the background on this and how VOYCE got involved. And then we will pass it over to Representative Murphy, which is why you really came here. Marjorie, can you go to the next slide, please? So like I said, I'm going to give you some background on what authorized electronic monitoring is, our involvement, and then just a few older adult abuse facts and the need for authorized electronic monitoring in long-term care. Marjorie, go ahead into the next slide. So understanding authorized electronic monitoring, I'm not going to go into too much detail here. Representative Murphy is the real expert on this, and he's going to give you all the information you need to know. But I just want to make sure we all have a baseline understanding of what this is. So basically, this is a fancy way of saying a video camera. It's a statewide policy that will allow residents in every long-term care facility to have a camera installed in their bedroom. Prior to this policy, it was really left up to the individual facilities to decide whether or not they wanted to allow this and how they were going to implement it. And so what this policy does is it gives a guideline for everyone across the state on how to do this. Some things that it is not, authorized electronic monitoring is not a hidden camera, and it cannot be used as a spy tool. So in other means, it can't be used to spy on someone within a nursing home or staff or anything like that. The nursing home has to be aware that this camera is there, and it has to be very visible and known. And then one of the most common questions that I'm asked is it a HIPAA violation? And it is, in fact, not a HIPAA violation. And again, Representative Murphy can cover all that, but I just wanted to make sure that we were all understanding that from the start. Go ahead to the next slide, Marjorie. So VOYCE's involvement in this bill started many years ago. As many of you know, and for those who do not know, the VOYCE Ombudsman program, they engage in direct consumer level advocacy by sending residents into long-term care facilities to check on residents, ensure that they're being provided with quality care and that their rights are not being violated. But another piece to this program is systemic level advocacy, which involves advocating for regulations and policies that will have a direct impact on these same residents. And this can include advocacy at a community level, state level, or federal level. So I like to say that we are the voice of long-term care residents in the Missouri State Capitol. And we, like I said, we got involved many years ago, and we believe that it's a really direct fit with our mission statement, which you can see on the screen there. And it kind of stemmed from hearing all these stories and situations of abuse and even death of long-term care residents and how we could go about fixing that. And so that's really how VOYCE got involved. Go ahead to the next slide. So just a few facts and kind of some of the facts that got us really interested in this. And sparked our need for this. And while these facts are very recent, they're all from 2019, I will say that this is a common theme that has been occurring for years in the past. But I tried to find our most recent statistics for everyone today. So there are currently federal standards aimed at protecting residents from abuse and neglect in long-term care. But unfortunately, many of these standards are poorly enforced by oversight agencies. So according to the U.S. Government Accountability Office, 1 in 10 people of the age 60 or older will experience some form of abuse each year. And this is people within long-term care and within living independently within the community. And that abuse could take the form of emotional abuse, physical abuse, sexual abuse, or financial abuse. And then a 2019 report from the Office of Inspector General suggests that 84% of potential abuse and neglect cases in long-term care go unreported each year. And that same report shows that 1 in 5 Medicare claims for emergency room visits are from nursing home residents were the result of potential abuse or neglect cases. So we have 1 in 5 Medicare claims as a result, potential result of abuse and neglect, and 84% of the actual cases going unreported. And then a last fact from the U.S. Government Accountability Office, the nursing home abuse citations more than doubled from 2013 to 2017. So can authorized electronic monitoring lower risk of abuse? Well, this electronic monitoring is not necessarily a solution to abuse. And what I mean by that is it does not reduce or eliminate the factors that lead to abuse, such as really low staffing levels or caregiver stress, or just bad apples that are going to abuse just for the intention of hurting someone. So it does not eliminate those factors, but it does, however, as politicians like to say, it's a tool in the toolbox as a means for protection from abuse and neglect. So for that reason, we believe that it is a deterrent to abuse and neglect, because older adults have the highest risk of abuse to occur when they are alone with a caregiver. So this is really common in nursing home and long-term care settings when caregivers are going into resident rooms to provide care and they're alone behind closed doors. And when a video camera is installed, the residents are quote unquote with another individual. So there could be someone on the other end of that camera watching, and it reduces their alone time to act as a deterrent to abuse and neglect. And then additionally, authorized electronic monitoring can confirm or deny allegations of abuse. And this can be particularly important and useful for residents with Alzheimer's or dementia who may be confused about the situations that are occurring and make inaccurate claims about abuse. And this camera footage can really prove what is happening within these facilities. So that's some of the reasons why VOYCE got involved and the thought process behind the electronic monitoring. And so there's my contact information if you'd like to contact me. And then again, there's our upcoming events. We do have our crash course events coming up for family members or those who are interested in having cameras installed. And there's the dates and times again. And then I'm going to pass this over to Representative Murphy, and he's going to tell you all the details that you need to know.
Okay. Well, thank you very much. I'm very happy to be here today, and sorry for the purple picture. I'm really not that color, but at any rate, I want to tell you a little bit about how I got involved with this. In my first year of the legislature, I got a call from a lady named Martha Udeli, whose husband was terribly abused in a nursing home, and it became her quest to try to prevent that in the future. So she was always a big proponent of cameras in the nursing homes. There's lots of bills that had been previously filed on this subject, and for the most part, all of the bills came at it at a good guy, bad guy type scenario. The nursing homes were the bad guys and the patients were the good guys. When I got a hold of this, I was told that you couldn't pass this because the nursing homes didn't want it, and there was just too much pushback. And I pretty much determined there had to be a way that we could make everybody come to terms with what needed to be done and what protections our patients needed. So we went into negotiations and started looking at it from a good guy standpoint, and that is, we all want quality care for our patients, for our elderly, and that if abuse takes place in a nursing home, it's probably not something that the nursing home is doing. It's a bad apple, and it's a bad situation that needs to be taken care of. The original bill that I first saw when I came into the House was one that said monitoring can happen if the nursing home or the facility agreed to let that happen. And we all knew that that wasn't going to happen. So we needed to find a middle ground. The Missouri Healthcare Association was very open. We had plenty of negotiations, and I took it from the standpoint, if I was them, how would I feel about this? And frankly, as a business owner, if the customer came in and said, I want to put a camera in and watch what you're doing all day, I'd probably have a problem with it. But this was a little different. It was the care of patients, so we needed to look at what can we do to make that happen. The biggest concern was the facility had no control over the feed. So if a family or a patient put in a camera, the feed was leaving the facility. They had no control over it, and they didn't feel it was fair to their staff or to them, in fact, that this feed was going out there and nobody knew what would happen to it. So if a nurse came into the room, dropped a bedpan, tripped over it, and it became real funny, would she become a YouTube sensation? And I believe that was a real, honest to God a concern that needed to be addressed. After spending the summer together talking this over, we finally figured it out that what we needed to do was to have a joint ownership of the video, so to speak, so that nobody would be just releasing it here and there. No, you couldn't put it out on social media unless there was abuse and neglect, and then it could only be released to the authorities. And any other release other than that had to have a written consent from both parties. So that was the dam breaker that got the bill moving forward. We went through a lot of different scenarios as to HIPAA violations, privacy issues, staff privacy issues, patient privacy issues. We require that signage be put up in the room so that everybody that comes in knows they're being surveillanced. If there's a 2-patient room, both patients have to have signed off a release saying they understood that it was being done. When a camera is put in the room, there's an understanding of it can never be turned off except under certain predefined situations. If a doctor's coming in and doing an exam, with permission, that camera can be turned off, but it's got to be agreed upon thing. And there's lots of protections for the nursing home on that feed. If the person that controls it in some way violates somebody else's privacy rights, the care facility will not be held responsible. The person that actually did the violation by releasing it would be the one that's held responsible. I was very thankful for the support that the Missouri Healthcare Association gave me once we came to an agreement and we realized that we had a bill that would work for both parties. They were very supportive of it. They helped me get it across the line on the last day. The governor's office was very supportive of it, and VOYCE was very supportive of it. And I think we have a bill that really works for everybody. And if you have any questions, I'll be glad to take them.
Great. So we have a couple questions already lined up, and
Okay.
if anybody wants to continue asking additional questions feel free to put those in the Q&A and we will try to make sure we get to all of them, but we have a lot already, so let me pull them
Okay.
up here. So first question, who does the resident get the choice, a resident or their family get the choice of where they want the camera in their room?
The camera has to be put in plain view, and I think it has to be somewhat of an agreed upon spot because we can't do damage to the facility, but it has to be a spot where it actually can monitor the care of the patient. But a lot of things will come into that because you have to have electricity for it. The facility is not required to give internet access. They can get their own hotspot. They are required to give electrical service to it. But I think that's really something will be worked out between the two. There's no requirement either way.
Okay. Are folks able to have audio on the camera in addition to just video?
Yes, they can have their audio.
What recourse does a family have or a resident have if the facility still says, no, a camera is not allowed?
Well, the agency will take care of that. They will censor them. They can take their license away. They can do all types of things, and that'll be all written up in the rules that are coming out from the agency.
Okay, and that's Department of Health and Senior Services, right?
Yes.
Okay, perfect. Can the facility limit or control the bandwidth or availability of the internet?
No.
Can they refuse to allow a resident to install their own internet service to support the wireless function?
No.
Can a facility charge a premium to residents with cameras to offset the cost of what in the past had been free internet or cable?
No.
So if there is a free service, can the facility turn that on and off at will?
It's up to the patient to supply the internet. So if the facility does not wish to give, and the facility is not required to give them Wi-Fi for this. So if the facility does not want them on their Wi-Fi, they can require that they use a hotspot.
Okay. So here's the big question in the days of COVID. How could a family install a camera right now if they're unable to enter the building due to quarantine?
That's something we're going to have to work out through the agency because, frankly, I don't know that there's a mandate that says you can go in or can't go in, but that's going to have to be handled through rules. It's not in the bill.
I would probably suggest that with the 3-phase reopening that's going on right now, that the people that come in to install the camera or the family that comes in to install the camera is going to have to follow that same reopening guideline. So if the facility is allowed to have visitors in based on where they're at within their reopening plan, then people will be able to come in and install cameras, and if they're not, then it's something that will unfortunately have to wait until it is safe to enter the facility.
Although I would assume that facilities today, when they have mechanical problems and so forth, allow repair crews in. So there's got to be some procedures within the facilities already for that type of thing. And you know, this is a situation where we're trying to please everybody, but I think a little cooperation, I think we could probably get it done pretty easily.
Can a facility refuse to allow a camera to be wall mounted?
I assume they can because it's their property, but they can't refuse to have it in the room.
Right here.
And let's see, got some more here. There's a lot of them coming in. Thanks, guys.
That's fine.
In the case where there's no roommate in a room, can a resident or their family decide where to position the camera?
Yes.
Another question. The question is only in rooms. What about public areas where visitors might be meeting with a resident and could be emotionally abusing?
No, it cannot be in a public area because there's too many HIPAA violation possibilities there.
And then will the long-term care communities be mandated to provide residents to have access to computers? This question asker says, when the Chinos has a computer, but it sits until someone on staff needs it and then is off limits to residents, although it's in the room where the resident can be accommodated and do have ability to gather.
No, this does not cover that at all.
Okay. Does this law include folks that live in both assisted living and skilled nursing?
The bill itself defines it as any long-term facility, includes. So I would think yes.
Okay.
I believe it does. Long-term care would be residential care, assisted living, and then skilled nursing. So I believe it does.
I believe, and that's defined in the bill.
We'll give Nicole or both of you guys a softball here. What's the bill number?
1387.
What happens when a resident is dressing or undressing?
They can turn the patient can turn it off.
I think that is set up in the form, so there will be forms that will be required to be filled out before a resident can have this installed, and I think it's specified in there if there is a time when the resident would like the camera to be turned off or the guardian would like that to be turned off, that can be included onto that form so that it will be agreed upon before it ever goes into effect.
Exactly.
And at the same time, we do know that many cases of sexual abuse do occur when a patient is dressing or undressing. So it may not be something that everyone wants to have turned off during that time.
But it will be up to the family and it will be up to the patient to specify the times that it can be turned off.
Will surveyors investigating abuse have access to the video?
Authorities will, yes.
Like state surveyors of the facilities, I don't believe so.
I don't believe they would, no.
No, but they like investigative proceeding, however that works, authorities will have access, yeah.
If a resident has dementia, are they given a choice as to whether or not they can have the camera, or does their family have the final say there?
There's a big section of the bill that goes into that as to whether or not if the competency of the patient is such that they can make the determination, they can do it. Other than that, it goes to the guardians.
Are there any limits as to how the cameras are pointed? Is a camera pointed at a resident's private body parts okay?
It'll be up to the patient and the family to determine how they position the camera.
Okay. Can a facility ask for the camera feed at any time?
Yes.
And how would they go about doing that? Or what does that, do we have a process for that yet, or is that something that's going to be in the rulemaking?
That'll be in the rules. It's in the bill that the facility has the right at their cost to request the copy of the feed.
And I think we may have answered this one, but just to be sure, we're asking exactly the same question. Are nursing homes required to provide free Wi-Fi coverage, as it can be kind of expensive to provide that kind of bandwidth?
No, they are not required to provide any.
Okay.
The only thing the nursing homes will provide as far as this bill goes is the electricity that is associated with plugging in the camera. That's the only cost on the nursing homes or the long-term care facilities themselves.
When does this go into effect?
Went into effect August 28th, and we're just waiting on the rules now.
Now, what recourse does a family or the resident have if their camera is tampered with, covered, disabled, either intentionally or unintentionally?
Again, that's prohibited in the law, and then it's up to the department to enforce whatever punishment they feel is deems necessary.
What
They
if,
also have a civil, if they feel the facility has destroyed their property, they can take civil action on that.
what if one resident in a room wants it, but the roommate does not?
They cannot have it. Everybody in the room must sign a waiver to it.
I believe the bill specifies that the facility, I don't know the exact language, Representative Murphy, you might know this, but it's something to the extent of the facility will try to find or move a roommate to
Yeah,
a different room, or to every extent possible to make it
right.
work.
That's exactly right. It says that the facility shall try to do their best to move them to a room where they can have it.
Excellent. One of our next questions is there a link to the bill? And we will make sure that that link directly to the bill's language is up on this page, or on the page where you registered for this. We'll have the slide presentations and a link to the bill, and eventually a link to the rules.
Yeah. If you go to house.mo.gov, that's mo.gov, you can put in the bill number 1387, and it'll bring you right to the bill.
Perfect. Now, what if a patient wants this, but the family does not?
Well, I don't know what, it's the family that's probably that would be viewing it, so it would be a feed to nowhere if the family wasn't going to be involved.
If the patient if they had their own guardianship, they would technically be allowed to install this. If maybe like if they themselves said, I'm being abused or I'm being neglected, they could have this installed and then have that video proof for themselves or for
Sure,
whoever
they could do
need
that
to report it to.
Yeah.
On the flip side, what if the family wants it, but the patient does not?
Now, if the patient is coherent and capable of making their own decisions, then it just won't happen.
So I think all of us, or anybody who's been involved in a dementia unit, knows that sometimes patients wander into each other's room. How do you protect the privacy of the patients that may wander into a room that has a camera?
Well, there's going to be signage. It's going to be required to be posted at the door saying that there is video monitoring going on. Now, whether or not people can read it, or that could be a problem, but I would assume that anybody in that situation would probably have somebody watching them.
Okay. Will it be the responsibility of the staff in the long-term care facility to turn off the camera in all requested situations? And if it's forgotten, will that be considered a violation?
I don't think that is specified as a violation. It would be a violation if they turned it off and it wasn't specified.
Are there parameters regarding the type or model of the camera that they would place?
No.
That would be also, I think, specified in the rules. And I know some states allow like two-way communication devices and other states do not. And again, we're still waiting on those rules to come out from the department.
And I think in our crash course for families, we're going to have some suggestions. I wouldn't even call them recommendations because we don't want to be in favor of one company or another, but I think we're going to have we think these will work options during that one.
Considerations for buying a camera was what we're doing.
Well, that's good work. Good for you.
Can the community limit if these are recorded and how long it is being saved?
No, I don't think so, no.
So with the cameras, and again, we'll cover this in our crash course, but each camera company works a little different. Each camera has their different amount of memory and how much is saved. And, some companies you can pay a monthly fee to have up to 60 days stored of footage. And So it's really up to the individual what they want saved and how much they want saved.
Yeah, but it can also be downloaded into your own computer and kept forever. So,
Correct.
but there's no limitations within the bill on that.
So who would make the choice about turning the camera on and off if the resident's choice is different than the family's choice?
Well, it's whoever has guardianship. You know, if the patient is coherent in making the decisions, then it's up to the patient. If the family is the guardian, then they would make the decision.
Okay. And if the resident is physically incapacitated, which staff will be allowed to turn the camera on and off?
Whoever is designated to do so for whatever reason. We don't specify who can and who can't. We only specify who can give permission.
Can the community limit where a camera could be placed for safety reasons?
Absolutely.
And then what about in a situation where a staff member feels uncomfortable undressing a resident in front of the camera, if the resident's chosen to leave the camera on for undressing? What rights does a staff person have?
There are no rights whatsoever. I mean, the camera is there to observe. If it's deemed to be on at all times, it'll be on at all times. It'll be up to the facility to facilitate that.
So I know we talked a little bit about signage, and we've got another question about signage. Does each room have to have signage as to if it's being monitored or not? Just those that are monitored? How does that work?
Any room that's being monitored will have to have a sign posted at the entrance.
Yeah, there's no sign for if there's no monitoring. You don't have to say this room is not monitored. It's just the ones that are have to have a sign.
If the department is presently putting non-imminent jeopardy reports on hold during the pandemic, how will complaints be prioritized or investigated?
That's a question for the department, I believe. I really don't know at this point.
Yeah, this bill originated quite a few years ago. And even in 2020, this bill was filed long before we even knew what the pandemic was. And so anything kind of related to that is not included in this bill. It's been in work for years. And then this was a little kink that got thrown into things.
Although I will say that COVID actually helped get this bill through because of the situation we have where the visibility to our loved ones, cameras became something that became a bigger issue.
Will the facility be responsible if the equipment is damaged during care or by the resident? So complete accident, it sounds like. Is the facility responsible for that?
I would say if the facility damages it, yeah, they would be responsible, but that would only be if it was due to their negligence.
Do the facilities have any obligation to tell the families of this bill being another option to protect their loved ones, or is this just something that people have to kind of find out about?
There's nothing in the bill that requires them to disclose it.
Okay.
But I think it's gotten enough press where people know about it.
When will the rules be finalized?
Excuse me?
When will the rules be finalized?
That's a question I've asked every day for about the last month, and I don't have a good answer for that yet, but they said they're working on them, they'll be soon.
Okay. What's a reasonable, or is there a required time frame for a skilled nursing facility to respond to a family or a resident who wants to install a camera?
Well, the facility has to facilitate the installation, has to allow them to do it. The COVID situation is the only kink in the works, so to speak. But under normal circumstances, there shouldn't be any delay. You know, as long as the family is prepared and has the equipment to do it and can do it in a safe and manner without destroying any property of the facility, the facility should allow it to happen, right away.
And one of these questions says, it seems like the writing of the bill is waiving HIPAA rights in the bill. How is the state able to waive a federal law, or how is that working?
No, it does not. We covered that pretty thoroughly with the lawyers.
So just to clarify, the monitoring, can it be video and audio, just video, just audio?
It can be both.
Okay. If a family has two members in the same room, can two cameras be installed so that both beds or sides of the room are equally monitored?
Yes.
And does a facility have to assist the family with the installation of the cameras?
No.
What if, and again, back to dementia a bit, what if a camera gets lost in the dementia unit because maybe another resident picks it up and takes off with it? Who's responsible for the camera at that point?
I would assume it's the family.
Okay.
But they would have video of that happening.
Yeah. Well, that is true. You'd see it until they unplugged it, I would assume.
Right.
I would say that's definitely something they'd want to consider when deciding where to place the camera as well. How can we safely place it where it's not going to be accidentally or intentionally hurt by staff, residents, whoever it might be.
Yeah, and I think there would be some cooperation, with the facility and the family. Obviously you don't want to put the camera on the serving tray where it's going to have to be moved all the time. You want to have it in a fixed position where it's there and everybody knows it's there and you won't block it. Common sense should rule the day, but we know that doesn't always happen.
Do we have other questions? We ran through about 50 of them, which
Wow.
by far the most questions we've gotten in any session. So, but we still have a little bit of time if anybody else has additional questions.
I have a question, Marjorie, or Representative Murphy. If a family sees or suspects abuse or neglect happening based on camera footage, how long do they have to report that?
They have 7 days from the time that they observe the abuse. Now, that isn't 7 days from the day it happens, it's 7 days from the day they observe it. So if they go back into it, 2 weeks later and then they find it, they have an additional 7 days to report it.
I suppose that's really important, again, in these times, if a family is able to get their camera installed, facility closes again, a little bit of time goes between talking to their loved one and then find out about something later. That gives them some extra time.
Yeah, and 7 days is plenty of time after there's abuse, but it's not limited to that 7 day period. It's 7 days from the day you observe it.
Okay. One of our questions askers is asking why not 48 hours to report?
Originally, I wanted no time limit. we compromised on 7 days.
And
I think the idea is that not everyone's sitting around staring at the camera footage all day long.
Exactly.
Because people on the other end of the camera will have jobs and, grandkids or kids and whatever it is. So it's a reasonable amount of time for the family to look back at the camera and give them time to really observe what's happening.
And it really is a monitoring system. It's not a spy camera. We're not, I hope nobody's sitting around spying on every action that takes place during the day.
And I suppose to double check now, does this bill make family members a mandated reporter of any kind? So even if they saw abuse and decided not to report it, could they do that?
They are not a mandatory reporter.
Do facilities need to develop their own facility-based or facility-level policy for the cameras?
I would suggest that they would. If I was a facility, I'd probably now offer it as a service to attract patients, because cameras are everywhere today. They're considered security, and I will tell you, I don't expect these cameras to catch as much abuse as I would expect it to deter a lot of abuse. As was stated earlier, our biggest problem in nursing homes and in long-term facilities today is getting good help. It's hard to find. It's hard work. It's low pay. And there's just not a big pool of people out here willing to do it for that. So we don't always get the cream of the crop, and sometimes there's abuse going on. At no fault of the facility. They've done everything they could, and they thought they had somebody who was reliable, and they have low tolerance for patients that require a lot of tolerance, and sometimes they do things that are just just a, just terrible. But the camera protects both ends of this. It protects the facility, protects the patient. So if I was a facility, I would look to put them in myself and just offer it as a service.
It really increases that transparency of what's going on and can improve the reputation of a facility that is providing great care and really has no reason to not have that camera installed.
Yep.
Are there different considerations when you're dealing with a population that has severe mental health issues?
The only difference in the consideration is who has the right to put the camera in, who has the right to say over what's done with the camera. It goes to the guardianship rather than to the patient, but that's the only difference in the consideration.
If a resident has severe mental health issues, but they still have their own guardianship of themselves, then again, they get to decide this.
Right.
Can a roommate who agreed to have a camera placed in the room that's really usually focused on the other person use that footage for their own claims?
Any abuse can be reported.
And then what's the facility's responsibility to notify family members of a resident on the floor, on the same floor as those that has a camera? So letting the other folks know that, hey, there's a camera on this floor.
There are no requirements.
Is there a plan for families to contact the community about some first-time issue? Maybe it's a small one, rather than call the state for any minor issue.
No, yeah, that's always available to them. In fact, you would hope that anything they see that doesn't constitute abuse or neglect, that they could contact the facility and say, look, we've observed this, and this is something we'd like to have corrected. That's a right. They would have that same right today if they walked into the room and the patient said, so and so was rough with me today, but it wasn't to the level of abuse. You would certainly be talking to the facility, and I don't think the video would be any different than that.
And if a room is being monitored, is the facility still required to notify family of falls, et cetera, things that might happen in the room that they're typically required to report to a family?
Yes, I would still be required to do that.
Okay. Other questions? Getting to the end. I guess one question that I have is, I know there's a limited number of folks who can view this footage. That would include the family. It includes police. Right. Does it include anybody in the ombudsman program?
It says only to authorities. Now, it doesn't define who the authorities are. It was meant to mean law enforcement authorities. Okay. But I would assume you could also, since the department is an authority, release it to them.
Okay. More questions just rolled in.
Good.
If a family wants to check incontinence care, can they ask all care to be provided in the room so that they can document lack of care?
I'm sure they could request that. It's not specified that the facility would have to agree to them to do it.
Yeah, that's a hard one, especially with, I mean, incontinence care, maybe, but I mean, some things have to be done in a bathroom, and you
Yeah,
can't bring the bathroom to the bedroom.
right.
So,
And here's one I can answer, which is great. Will the ombudsman receive additional training related to the handling of the camera questions and complaints, like family members who now watch and will see that staff aren't coming in every so often or disapprove of general but maybe acceptable methods of care? And yes, our ombudsmen are actually going to be getting additional training as part of their continuing education too. The great thing about the ombudsman program is we require our ombudsman to have a lot of training, so this will be one of their opportunities. So that's a good thing.
There you go.
If a resident uses a speakerphone for conversations, which then would be caught on the audio version of the recording, is there any obligation to tell the callers that that recording is occurring?
No, actually, under Missouri law, you could record anything as long as one person in the conversation is aware of it. So, no, there's no obligation to tell the other person that it's being recorded.
that's with all recording, like not even just electronic monitoring, but across statewide, you can
Right,
record things. We're a single party consent state. So, in all situations, that's allowed.
right.
What if a roommate agreed to have a camera in the beginning but then changed their mind? What's the next step for the facility?
If the roommate decides that they no longer want it, then it has to be removed. Or the patient that wants it would have to be moved to a different room.
What, if any, right does the facility have to request to see any time sequence of the video stream?
Editing of the video is prohibited. So they can either get all of it or none of it. And that's done to protect, obviously you don't want a video that's been altered or edited in any way to make it look like it's something it's not. So it's required in the bill that the video be kept intact. So if they want the video, they would have to get the whole thing.
Okay. I am out of questions in the question queue, so I'm going to pull our winner for our drawing, and our winner is Joan Sievert from Flourish Therapy Services. So congratulations, Joan. We're going to connect you up with the folks from Guardian Pharmacy, and they're going to send you your gift card. So congratulations. Representative Murphy, Nicole, do you guys have any last thoughts, any things that you meant, man, we needed to go over that thing before we leave?
Well, I'd like to say, this has been a quest of mine for a number of years now, and I am so thankful to VOYCE. I'm so thankful to the Missouri Health Care Association and everybody for their cooperation in getting this done. I think it was an important bill, and in this time of COVID, I think it's even more important. I think it's going to help protect our elderly, and hopefully we've built in all the right protections. But if we haven't, we'll find out pretty quickly, and we'll figure out how to fix it. But and I'd like to thank you for having me here today. I hope I've answered enough of your questions to kind of clarify everything. Yeah.
Yeah, and I would just like to thank Representative Murphy. He's put in a ton of work on this bill. I mean, in the session, outside of session, he's done a lot of work on this. And we appreciate everyone being here. It's probably a little known fact about me. I used to work as a support coordinator in an RCF. And so I kind of can see both sides of the hesitation from some administrators and some of the concerns that these facilities are going to have. And then working for the Ombudsman program, I also see the importance that we really protect these residents. So we're really thankful that everyone's been here and you're open to learning more about this and moving forward on this issue with us.
There you go.
Excellent. And thank you all so much for participating today. I think we got up to 60 questions by the end of this. So I love the participation. I love all the questions. It's awesome. And thank you so much to both of our presenters. Again, if you've got, you have family members or residents who are interested in learning more about the specifics once once the rules come out. And frankly, all of you are invited as well. We have those sessions coming up on the 8th and the 14th. And that is a free session for the community. So come on out to that. It'll be kind of a very similar format. Nicole will be one of our presenters, along with, I think, probably Chin or some other folks. We'll have some folks there to help answer all the questions. Thank you so much, Representative Murphy and Nicole, for a great session. And thanks to all of you. We'll see you on September 1st for our next session on ethical concerns. We'll talk to you all soon.
Thank you.